I had a patient, was actually 21 years old, her first experience with Hodgkin's lymphoma. She was a junior in college at St. Bonaventure's and had gotten treated at Roswell Cancer Center in Buffalo, a very famous one. At this point, she underwent and completed only 4 of the 12 scheduled chemotherapies. She had such profound nausea and vomiting, and her hair fell out. It actually took a year to grow back, which is kind of unusual because usually once you stop the chemo in 2 or 3 months, it should be back. She had since moved to Amherst, Massachusetts, and her tumor had recurred. Actually, it had gotten bigger. It had never gone away. Her doctor there called me in Rochester, New York, and asked if we'd meet with her and talk with her and see what we could do to help out. We got a CAT scan at Rochester General, and I'll never forget, the tumor had quadrupled in size, was surrounding her heart. She had effusions of fluid in the lungs. And the radiologist was a good friend of mine, was reading it there for the 2 of us, and as he pointed out, it had quadrupled in size. She just turned around and into my arms and started sobbing. And she had worked so hard. She was very holistic into organic diet and such, and it hadn't worked for her. And in the meantime, Lori Monroe and I were meeting with William Buhlman for a television pilot in Atlanta. And when I was there talking to her off camera, I just told her my ideas about chemotherapy companion. Let's make a CD with Hemi-Sync specifically for chemotherapy patients. And I was hoping she'd say yes. What I was blown away with was she said, hell yes. And in 2 weeks, I had the first beta version already. Darlene Miller voiced the script. I couldn't believe their quick response. Anyway, it arrived the morning of her first chemotherapy. She'd already gotten it the day before. I got a call at the place she was staying. She'd been vomiting nonstop for 4 hours. Put her in the bed, put the headphones on, and played it for, it's about 45 minutes. And it's got guided imagery, for instance, to place your hands over your upper stomach and picture warm love infusing into that, which is basically an image to put energy there, which will help with the nausea and vomiting. And they use what the neurolinguistic programmers would call an anchor. Inhale, exhale, think plus stomach calm. And so later, should they develop nausea or vomiting with a chemo, you just think plus stomach calm to induce that healing state again. And the amazing thing, at the end of 45 minutes, she took the headphones off and she said, that was my good friend. It was Darlene Miller. She goes, they recognized the voice because she had done the Positive Immunity series and a bunch of others. And the second thing she said was, I feel great, and sat down and ate lunch and never had another episode of nausea or vomiting. And went on to do really incredible. So we were thrilled, and I've used it with a number of patients, and I just love the feedback we get. They find it very helpful. In addition, we've developed one for radiation therapy because, again, it can have effects on the skin and deeper tissues, and we found you can improve a lot of that with energy therapies, and henceforth we developed the radiation therapy companion, and we added one for the immune system, journey through the T cells, which had been there prior, to help bolster the immunity, and sleeping through the rain, because one of the things I found is often there's some trouble with sleep, and at a minimum it's great for relaxation. It's great for listening to at home if you're feeling tense. It's great for doing Reiki or yoga or anything else. So it's a really nice combination of 4 CDs.